Good day. My name is Adam Sinswat. I am a computer programmer 1 at the Department of Health Center for Health Development. I will teach you how to use the Integrated Clinic Information Systems ABTC or Animal Bite Treatment Center consultation. This tutorial assumes that you already know how to set up the iClinic SIS. Log into the system and go to the Electronic Medical Records page. Before adding a new patient, make sure to try searching for their name first to avoid duplicates. Typing their first name and last name will suffice. Click on the search button to begin searching for the patient. Since the search gave us 0 results, we can now go ahead and register the patient to the system. Click the Add New Patient button. Before we begin encoding the patient demographics fields, let's first begin by adding the profile picture of the patient. Click the webcam button near the profile picture. Make sure you have set up a webcam device if you're using a desktop or if you're using a laptop. Make sure your laptop has a built-in working webcam. Once you're ready, click Take Snapshot to take the patient's picture. Click Save to use the picture taken for the patient's profile picture. Encode all the data that has an asterisk beside an empty box. If you somehow change the default NA text in the middle name box, make sure you type the actual middle name of the patient and not retype N/A. The system will return an error upon clicking the Save button if you do that. If you set the employment status of the patient to employed, make sure that the patient knows their employer's PIN or PhilHealth employer number. This will be used later when submitting e-claims forms. Make sure that the zip code is correct. This will be used for the household profiling function of the system. If the patient is a DSWD NHDS member, then select the Yes option. Click the magnifying glass on the right side of the Family Household Number box. Here is where you search for the facility household members of the patient. Click either the name or household number to use that for the patient, or you can instead click Generate New to create a new facility household number. Encode the household number of the patient. Repeat the steps done with the family household number for the family serial number. For the PhilHealth member question, if you select Yes, you will need to encode the following details shown on screen. For the PCB eligible question, if you chose Yes, select the date the patient applied for primary care benefits package. If they don't remember, then just select the date the patient visited your facility. Let's go back and set the PhilHealth member to yes. If you select the PhilHealth member type of dependent, you will need to encode the following details such as relationship to member, the member's last name, first name, middle name, birth date, member suffix, and sex. The PhilHealth dependent number is optional. Let's switch back to the member status type. Click Submit once done. The next step will be about adding a new animal bite consultation. Click on the Add New Consultation button to begin. In the type of consultation / purpose of visit, click on the Animal Bite category. Click on the calculator icon near the patient height section and encode the feet, then inches to automatically convert the value to centimeters. You can also repeat the same steps for weight if you need help converting pounds to kilograms. Once you've typed the patient's height and weight, the BMI category will automatically be calculated. Usually the height for age and weight for age will also be calculated, but if it isn't, you'll need to manually select the correct option. In the Chief Complaint box, type the complaints the patient is having with his or her condition. Make sure to select the Yes option for the patient consent, otherwise you will not be able to save the consultation data. It would be best if you also have the patient read the patient consent form so they are aware that their data will be stored inside the iClinic SIS. You can also print this form so the patient can write their signature and contact number and have a representative of your facility to sign as well. Click on Submit to save the consultation data and end the process. After finishing the consultation process, you will see that there are 11 basic services. The ones I'll be covering will mainly focus on vital signs, physical exam, system review, doctor's order, and consultation status. We'll first begin with vital signs. Click on the Vital Signs button to begin. Then click on the Add New Vital Signs button. Type the value for the blood pressure systolic, blood pressure diastolic, respiratory rate, body temperature, heart rate, and choose whether the patient has a normal rate and regular rhythm. Type the value for the pulse rate, oxygen saturation, time when the vital signs were taken. BP measurement assessment, whether hypertensive or non-hypertensive. If hypertensive, did the patient took any hypertension medicine and who took the vital signs of the patient. Then add remarks you may have found. Click Submit to finish the process. Click back to consultation to return to the consultation page. Part 2 of the basic services process is the physical exam. Click the Physical Exam button to begin the process. Click Add New Physical Exam. The remarks boxes you see can be left empty so long as the preceding section has an option selected. For example, if the abdomen section has an option selected, you can leave the abdomen remarks empty. However, if the empty boxes don't have any options before it, you will need to type the findings in it, or if there's no findings, just type essentially normal. Only the Others section is exempted from this. Click Submit once you're done. Then go back to the consultation. Part 3 of the basic services process is the system review. Click the System Review button to begin. Click Add New System Review. I'm just going to go ahead and encode all the data required. Select among the following options for each category that applies. If none of them apply, select Essentially Normal. If the Essentially Normal is not available though, then encode it instead in the remarks box. You may also encode additional information in the remarks boxes. Click Submit to finish the process. Then go back to the consultation page. Part 4 of the basic services process is the doctor's order. Click on the doctor's order button. Then add a new doctor's order. Select the laboratory request and imaging requested by the doctor for the patient. Imaging has ECG, MRI, ultrasound, and X-ray as options. In the alert type category, there's allergy, disability, drug, handicap, impairment, and others as options. While laboratory request has blood chemistry, clinical chemistry, complete blood count, fecalysis, hematology, immunology, MTB gene expert, serology, sputum microscopy, and urinalysis. Select the correct type of diagnosis. If this patient will be availing of e-claims, then you need to set the diagnosis to final. Prescribed medicine is self-explanatory. Click Add New Prescription. Select the reference place you would like to search the medicine from. Usually the All Drugs category will suffice, but if you can't find the medicines there, you may need to search for it in the inventory drugs. You will need to manually add the medicines in the Logistics Management module's inventory list. If you selected All Drugs, click Search Commodity Medicine to search for the medicine. Type the generic name of the drug in the empty text box. Click on the drug code on the right to add that medicine to the prescription. Now type all the details needed for each empty text box like dose regimen, total quantity unit of measure, like 500 milligrams and such, intended purpose of the medicine, medication can be left blank, and lastly, the doctor or pharmacist for the prescribed by field. But it is highly recommended to choose the doctor by default. Click Submit once you're done. If you click the checkbox on the left side of the medicine record, you can create an electronic prescription that you can print. You can add another medicine by clicking the Add New Prescription. Once you're all done, click the Submit button to finish the process. Click the lab result link to view the laboratory request results. You see that we only have CBC as an option, and that's because it's the only one we check for lab requests. If you selected more, they will appear in this dialog box. Only fill up the empty boxes that matter. What I'm typing is just sample data, so don't mind it too much. Click Submit once done. If you click on the form link, you will generate an electronic form of the laboratory blood result, which is printable. Make sure you have already added the medical technologist in the system in order for them to appear here. If you have any imaging request, click on the imaging link. From there, the process is the same as the lab result process. Click back to consultation to finish the doctor's order process. Part 5 and the last of the basic services process is the consultation status. Click the consultation status button to begin. Click Add New Follow-ups to add a new consultation record. Select between the two consultation status, completed and incomplete. Then if there are any remarks, type them in the follow-up remarks. This concludes the basic services transaction process. The next topic we will discuss is the Animal Bite FHSIS process. For this part, I will teach you how to do the Animal Bite process. Click on the Animal Bite button under the FHSIS Services category. Then click Add New Animal Bite Case. Select the anatomical location of the animal bite. Then select the type of animal that bit the patient. Select the type of exposure from the given options. Choose between yes or no if the patient washed the bite area. Date exposure refers to the date the patient was bitten or infected by the animal. In the place of occurrence section, it refers to the place the patient was when exposed to the infected animal. Provide the region, province, city/municipality, and barangay. Provide the correct dates for the anti-rabies vaccine injections given to the patient and the rabies immune globulin. You can update the ARV injection dates if they had done it at a later time. Click Submit once done. To update the animal bite case, just click the pencil icon. You can update the blank ARV dates if they have taken the vaccine. Repeat as necessary. It is necessary to reselect the animal bite location again when you update the record in order to save the changes done. Click back to consultation. This concludes the ABTC consultation transaction process. Thank you so very much for watching. I hope you learned a lot from watching this tutorial. Please give this video a like and subscribe to our channel. ICT Unit DOH-CHD RO12 for more videos about DOH Region 12's information systems. If you want to learn how to use the eClaims module of the iClinic SIS, you can go ahead and watch our eClaims tutorial video.